This means decreased blood flow, which can cause fetal hypoxia. So late decelerations, they go down after the contractions have already started, and then they go back up after the contraction has ended. So the nadir, when we talk about contractions, the tip of the contractions, always try and line up the tip of your contractions to where that decel is. If your contraction, so if I'm looking at this one, and obviously if I'm drawing this imaginary line, when is that decel happening? At the beginning of my contraction or after my contraction? After. So that would be your late deceleration. Okay? Does that make sense? Yes. So if our patient is experiencing late decelerations, remember the acronym LION. So left lying position, so we're going to turn left lateral, IV fluids, oxygen, or if they're on Pitocin, we're going to stop the Pitocin because baby's not liking that Pitocin, and then we're going to notify the provider. So position change should always be your first intervention. So if you have a deceleration, a late deceleration, turn your patient left lateral or to the side. So any side position. So in the lateral position, give an IV bolus, oxygen, or stop your Pitocin, notify provider. Okay, does that make sense? Yes. So late decelerations, good or bad?
Bad.
Bad. Our variable deceleration, so this is called by umbilical cord compression, so we kind of already touched base on that. So the first thing that we're going to do when we see that, so just remember your variables, they look like these. So they're very sharp and abrupt. So our B's are our W's. So that will kind of let you know if it's a variable. And usually you know it's a variable and not an early deceleration because it's an abrupt, deceleration, and it's typically pretty low from the baseline, usually by like 30 or 40 beats. Okay, so just, they look like these, they look like W's. So those are our variables. So cord compression, same thing that we would do for late deceleration. So what's the first thing we would do for an intervention? Position change, lateral position. Then what we're going to do? IV fluid bolus. Then what?
Oxygen.
Oxygen or stop oxytocin. And then what? Notify the provider. We can also try place in need a chest position. We can see if that helps as well. Sometimes you can put them in Trendelenburg too to kind of get baby off of that cord. So the head of the bed's this way to have gravity kind of help with that. But that's going to be our variable deceleration. So if you see a variable deceleration, late deceleration, same type of intervention we're going to do. We have to do some type of intervention because variable decelerations and late decelerations are bad. Okay? Does that make sense?
Yeah.
And then we'll go into, how we can fix it with an amnio infusion, but I just want you guys to kind of understand this. And then lastly, before you guys leave, know, veal, chop, mind. This will be your best friend. Memorize it because it will help you with a lot of questions on this next exam as well as the CMS. So your veal is going to be your fetal heart rate pattern, the cause, chop, and then intervention is mind. So our veal, chop, mind, we have our variable decelerations, which means our cause is cord compression. Our priority intervention, move the patient. Switch position, lateral position. Early decelerations means head compression. We don't need any interventions, that's fine. We like early decelerations. That's the only decelerations that we like. Our accelerations, if baby's having accels, that's great. There's no intervention needed. That means our baby's well-being is fine, we don't need to do anything. So accels are always good. And then late decelerations caused by placental insufficiency. And then we have to evaluate for why. So again, we're going to switch positions, stop Pitocin, give IV bolus, give oxygen. And if it keeps happening, late decelerations keep happening after every contraction, we're just going to call a C-section. We need to get this baby delivered because the baby's not oxygenating whatsoever. You don't want baby to keep losing brain cells. Okay. Any questions?
No.
So which are our favorite decelerations?
Early.
Which are our bad decelerations?
Late.
Late and
Variable.
variables. Okay, any questions on this?
No.
Okay, I think you guys are good, so just kind of review this, we'll touch base on it, next week when we go into contractions. Okay, we go ahead and turn the lights on. You guys are free to go.